Hello and welcome. It's 11 a.m. in Seoul. I'm Kim Mo-gan at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the coronavirus outbreak. In just a few moments, we'll cut into the briefing at the Sejong Government Complex with simultaneous interpretation in English. Yoon Tae-ho, overall officer of disinfection at the Central Disaster Management Headquarters, will be briefing us on the coronavirus situation here in South Korea. Now, to give you a brief idea of the situation today, South Korea reported 370 cases of COVID-19 Friday, inching a little down from the 400 mark. And of the new cases, 351 were locally transmitted and 19 were from overseas. 11 additional deaths have been reported, and the death toll is now at 1,459. Now we turn over to the Sejong Government Complex.
We have
Mr. Yoon Tae-ho who will be briefing us on the COVID-19 situation. Let us now begin our regular briefing for February 5th, Friday. As of today midnight, we have 351 new local infections and 19 new imported cases. Yesterday, we had 11 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. First of all, here are some updates on our antivirus quarantine measures. Yesterday, a total of 75,000 cases have been carried out, and at the makeshift testing sites, we have carried out the 44,000 tests, and also at the makeshift temporary testing sites, that is, we have carried about 35,000 testings. And if you have any suspected symptoms, please visit a nearby screening clinic to get tested as soon as possible. And we also have some updates on our medical response. We are seeing a continued increase in our securing of the hospital beds. And as for the critically ill hospital beds, we have about 507 beds available and about 12,000 beds available for mild or moderate symptoms, and we have 0 patients who are waiting to be hospitalized. Moreover, as for the people on self-isolation, we will also exert our full efforts to provide medical support, and we will be revising our current guidelines so that we would have detailed guidelines to provide medical support and services for those who are on self-quarantine. And also after self-quarantine, we will make sure that he or she will get treated as soon as possible. And also, if needed, we will also provide remote transcriptions as well. And as for the major medical services like giving birth or other kinds of medical services that are needed urgently, we will also help them to receive their treatment at the designated hospitals. And moreover, we would also provide intensified support to deal with the mental depression caused by COVID-19. And starting from January, we have intensified our mental consulting sessions for medical professionals as well as other residents. And we have also provided more than 3 million consulting sessions nationwide, including 1 million mental consulting sessions for the medical staff members. And we believe that the prolonged COVID-19 outbreak is also incurring a significant amount of mental damage to many people around the country. And also, we have seen that we had a very rapid surge in the number of people who are suffering from mental disorders as well as depression, jumping by over 20%. And to this end, we will also provide intensified support to provide mental consultations for those who are suffering from such depression. First of all, we will be expanding such a target to to all of the nation's citizens, and through our hotline, we will also provide such service to all of the citizens. And we will also utilize the mobile applications to provide remote services to many people as well. And second, we will intensify tailored support and mental consultations. As for the people who have been contracted with the virus or those who are on self-quarantine, we will provide these mental consultation sessions after 3 days they have been confirmed with the virus. And also we have many people, especially those who are employed and who are also job seeking, and also in the youth and also senior citizens who are living by themselves. We will also provide these targets with tailored support. And moreover, we will provide continued support together with pan-government ministries as well as the National Trauma Centers. And we will provide necessary cultural contents to them as well. And we will also provide intensified numbers of these trauma centers, and we will also provide necessary support at all of the 70 major cities and provinces nationwide. We will make sure that the COVID-19 prolonged battle against the COVID-19 does not incur much mental disorders or depression on the citizens, and we will also help proactively to alleviate such mental depression. And we also have measures to provide support during the Lunar New Year holiday. And as for the Ministry of Food and Drug Safety, we will be providing intensified on-site monitoring and inspection for restaurants and also many other facilities. And we will center around the restaurants, cafes, as well as areas where people will likely gather, and we will make sure that these businesses comply with the business hour restrictions. And we will also look into the franchise of coffee shops. We will make sure that all of the people are wearing face masks, and also they have a visitor log registered as well. And we are also carrying out these similar inspections right now, and these will go on for the future as well. And in order to also promote the voluntary support and participation by the public to participate in such quarantine measures, we are also actively proactively cooperating with the local governments. And we will also want to once again urge the public to always wear a face mask. And also when you are not consuming food, please wear your face mask, and when you are also conversing in dialogue. And during the past week, on a daily basis, we have 362 daily domestic average cases. We are seeing a downtrend of the COVID-19 infections here in South Korea. However, we still have many risks of possible infections, especially centering around day-to-day venues, including hospitals, restaurants, workplaces, as well as gyms. All of these places are susceptible to the virus infections. And if you are also at any of the confined, crowded, and close contact environment, please note that you could be exposed to the COVID-19 virus at any time, at any place. So please avoid going to these places. Moreover, please avoid going to confined spaces that have poor ventilation systems. The COVID-19 virus has been grappling the world for the past 1 year or so, and at all corners of the world, we are seeing the virus spreading at a very fast pace, together with the emergence of new variants. And compared to other developed countries, who are also grappling with and struggling with a rapid surge in the confirmed cases, we are also doing better than relatively, because thanks to the support and participation of the members of the public, once again, I extend my deepest appreciation to you all. In May and November last year, and based on these meetings as well as scientific evidence and proofs, we have been also revamping our social distancing scheme. And also during the past third wave as well. We have been intensifying our quarantine measures while we have been also alleviating any burdens on the public's livelihoods. And we will also revamp these schemes once again going forward, and we will make sure that they could also facilitate more voluntary participation from the public. And to this end, we carried out 2 rounds of experts consultations, as well as numerous other committee meetings, and we are also opening our ears to the opinions of many experts. And we will also provide a wise solution to deal with the pandemic. And as you did so far, please engage in these participation in the quarantine measures in the future as well. Thank you very much.
That was the government briefing. You just heard updating us on the latest COVID-19 situation in South Korea, which confirmed 370 new cases on Friday, bringing the accumulated total to over 80,000. There were 11 additional deaths. Now that does it for our coverage of this morning's briefing. We'll be back at 12 p.m. Korea time with our midday news with Mark Broom. Bye for now.